Um, our first speaker is someone I am really looking forward to hearing from. We have Veronika Panagiotou, PhD. Veronika was diagnosed with non-Hodgkin's lymphoma a few days after celebrating her 25th birthday. 11 years later, she uses her cancer diagnosis and the knowledge she's gained through the process to empower other cancer survivors and caregivers to tell their stories and support their advocacy. Veronika currently serves as the Director of Advocacy and Programs at Cancer Nation. She supports over 1,000 advocates that are part of the Cancer Policy and Advocacy team. She empowers and educates patient advocates on the most pressing policy issues facing quality cancer care to facilitate their engagement in legislative advocacy. In 2024, Veronika was awarded the 40 Under 40 in cancer for her work in advocacy. Dr. Veronika Panagiotou has presented research across the country and internationally on topics of cancer survivorship, community engagement, serves as a peer reviewer to evaluate research proposals, and belongs to various research advisory boards. Dr. Panagiotou, welcome to the exchange.
Thank you so much. It is an honor to be here. And I am so grateful for the invitation. Let's get these slides ready so that we can talk about advocacy. Okay. Okay, everyone can see my slides. We're all ready? Perfect. So I'm here to talk about self-advocacy today, what it is and why it matters. And it matters to all of us. So the agenda includes what is advocacy skills that we can all work on as we advocate for ourselves, and becoming an advocate. So let's get back to basics. And I always like to talk about definitions. What are we actually talking about? What is advocacy? And it is the act or process of supporting a cause or proposal. So it can be advocating, most importantly, and to start, it should be about ourselves. But then we advocate for things that we care about. Other sarcoma patients, the sarcoma community, the national cancer community as a whole. So we advocate for what means the most to us. And we should always start with ourselves. And so I always tell my advocates who I meet at the national level that do public interest advocacy, I ask them how they're advocating for themselves, because that is the most important piece, that we must take care of ourselves before we take care of others. And so having the tools and skills necessary to feel comfortable about asserting ourselves and communicating clearly about our needs, that is our self-advocacy. And then as we feel more and more comfortable with that space, I know many cancer survivors, me included, that we have this overwhelming need to give back or to serve. And that might start with advocacy to others. So sharing our personal experiences and insights to educate others in our local communities. And finally, advocates then get to the national level and they decide that they want to advocate for everyone, regardless if they have those personal experiences or not. They want to promote a set of ideals and outcomes that are favorable to the interests of the general public. Cancer Nation, formerly the National Coalition for Cancer Survivorship, was just on Capitol Hill last month advocating for those who receive Medicaid benefits and advocating for cancer research, regardless if they had received those benefits or if we all benefit from cancer research, so that's easy. But being able to articulate why those need access to healthcare. So our founder, as I said, we've been around for 40 years, and one of our founders in 1985 wrote one of the seminal pieces about survivorship in the New England Journal. He was a physician and a doctor himself, Dr. Fitzmullen, and he talked about this quote that still resonates today. And it's kind of the reason why we have to advocate, understanding our medical system. And I'm going to read it. Despite the success on the treatment front, we have done very little in a concerted and well-planned fashion to investigate and address the problems of survivors. It is as if we have invented sophisticated techniques to save people from drowning, but once they have been pulled from the water, we leave them on the dock to cough and to splutter on their own in a belief that we have done all that we can. And so unfortunately, 40 years later, that probably still resonates with you, because at every stage, there is some kind of splutter that we encounter in the healthcare system that isn't meeting our needs. So that requires self-advocacy. We must advocate for ourselves. So what does that mean? It's our individual's ability to effectively communicate, convey, negotiate, or assert their own interests, desires, needs, and your rights as a human being. It involves making informed decisions, also be a part of those decisions, and taking responsibility and accepting those outcomes. So why is advocacy important? So advocacy gives us, the patient, the survivor, stability and the feeling of regaining control in our lives. The healthcare system takes a lot of our control away. It takes a lot of our decision-making ability away. And we must be assertive in the fact that there are decisions that we should be a part of them, and we should be included in that decision-making process. It builds our confidence in a way to help us face these challenges that seem insurmountable. Advocacy is a way of reaching out to others because it's a form of communication. And so there should be reciprocity in the way we communicate. We should communicate, and then we should receive the communication back. And so we should always be in that communication loop. It should never feel one-sided. Advocacy improves our quality of life because we are making those decisions the best that we can, to the best of our ability, and hopefully they improve how we live this life. Advocacy for yourself may be the difference that turns your feeling of hopelessness and helplessness into feelings of being hopeful. You have hope for the future. Do you have hope that you're building a quality of life? We have to all live within the sphere of hope. And hopeful that regardless of what our outcomes is, regardless of what the quantity is, that the time that we have is full of love, joy, kindness, and hope. And it's, I say that lightly, but it's so hard to remain with those emotions, and recognizing that emotions are important and that we should feel all of them. And so there are moments of those other emotions, anger, frustration, sadness, so much sadness sometimes, but we have to be purposeful and intentional about not losing our hope. So what are self-advocacy skills? When we talk about self-advocacy, what should we be working on and what should we be intentional about? Well, we should, as cancer survivors and advocates, be information seeking. We should always be seeking information about our diagnosis, our treatment, our late and long-term side effects, and how to live healthy lives that are fulfilling to us. So information seeking. We should be always improving our communication, making sure that there's reciprocity in our communication, making sure that we're listening to others is very important in communication. and being able to communicate our rights, our needs, and our desires. Problem solving. We all know that as cancer survivors, there are so many problems, but it's how we solve them. It's not even how we think that we want to solve them, but can we pivot? And do we have the supportive structures to help us support ourselves and solve our problems? Because we can't do it by ourselves. And negotiation, I think, is the critical piece here, because within cancer care, within how we move about our lives, we can't get everything that we want. And I know that that's really hard, but we have to be able to negotiate and get as close to what we need as possible. And recognize that that's a win. Negotiating and getting a piece of what you need is a win. And it's something that we can build on. And maybe with time, we can get even closer to that ultimate goal and desire. But we need to be able to keep negotiating and getting a little bit of a piece and a piece and a piece to build. So I'm going to dive a little deeper and when we can use that in for all these skills and what that looks like within the cancer experience. And so information seeking, are we getting the full explanation of our diagnosis and our care plan in treatment and then post-treatment? And discussing those treatment options. What are the benefits? What are the side effects? What are both the long and short-term benefits and side effects? And having the full picture before we make decisions. Are we seeking second or third opinions if it will make us feel more comfortable, more confident in the decisions that we make, and not feeling bad about that? Having all the information that we need. And also, at any point during your cancer experience, if there's a moment that you're unsure, there is no wrong time to get a second opinion about anything. And so in our survey that we do every year, we find that people that it's less than 30% of survivors get second opinions, and that is too low. And so you deserve the best care. And to get the best care, you need all the information possible. Communication. So while you're establishing your relationship with your doctor, or as you continue to have a long relationship, you change as a human. We are not stagnant. Our preferences change, our technology changes. And so many of these things that I'm going to say seem like at the beginning of a relationship, the relationship that you have with your care team and doctor, but at any given point in time, you can always change how you want to be communicated to. So share with your doctor what's most important to you, your goals, your values, your cultural practices that you want to include in your relationship, in your treatment and your post-treatment. You want to establish your preferred form of communication, whether that be, are you an online portal person? Is texting, phone calls? Do you want everything via hard copy printed out so that you can put it on your refrigerator? And finding a team that is able to meet your communication style is very important. Selecting a healthcare team member and asking them to serve as your point of contact for communicating decisions, protocols, overall updates. Who's your go-to person in your healthcare team that understands you and how to communicate so that you're not communicating with 10 different people to relieve your burden? And establish who, when, and how to contact your care team if you have questions or concerns. What are their preferences and how to communicate? And can you, again, we'll get to negotiation, but can you find the best possible solution that meets most, if not all, of your needs? Problem solving. So problem solving, we all know that the first problem is I have cancer. And so that's a really huge problem. And so the first thing we need to do is recognize that you are an important part of the decision-making process. Actively participating to solve those problems is important when you develop your treatment and post-treatment plan that aligns with your values and priorities. Because you don't want people making decisions. If there's a small tweak based on what you value and how you live your life that would be more accommodating to you and improve your quality of life, make that decision, take that path in solving your problem. And secondly, when you're problem solving, it shouldn't be just on your shoulders. Building a support network is so important. Identifying and engaging with trusted family, friends, caregivers, and support organizations to provide you the emotional and practical assistance. And one of our programs that we just concluded, we talked about there is such a burden on caregivers. And so if we expand our team and there are more people to shoulder some of those burdens that we have as survivors, it's better for our overall family and quality of life. Are there people that are great or providing you that ride to your appointment and sitting with you? And are there people in there a lot in your life that are great to vent to on the phone? Those people might not be the same people. And so creating a team, your healthcare team, as well as your community that can be able to support you in all the different needs that you have, will help you solve problems that you have in a more burdensome way, and really feel that you are getting the support that you need and that your caregivers are getting the support that they need and have the time to get the support that they need to. Negotiation. So every part of your care and every part of the cancer care continuum, there are always points of negotiation. And so here's some examples, things to think about of ways and ways to communicate and negotiate. So discussing and potentially negotiating adjustments to that plan to better suit your needs and preferences. Is it that you would like to receive your treatment if you're working on Friday so that you have the weekend to recover? And so that on Monday you're ready to get back to work, because some of us need to work, for instance. Can you negotiate? One of my things that I negotiate is I would prefer to sleep in my own bed. And so if I have to be at the clinic at 8 a.m. the next morning, every day for the week, I would prefer to do that than sleeping in a hospital bed. So it is so important to know what your preferences are, and can you negotiate that? Giving a little to get a little is super important. Your side effect management. Are there better ways to manage your side effects to improve your quality of life? Your financial concerns. Is there any way to negotiate with hospitals, with your insurance company about managing your medical bills and understanding your coverage details? Workplace accommodations, negotiating with your employer for adjustments to your work schedule or the environment during or after treatment. I have a great friend who the light bulbs above her desk really bother her after she receives her treatment. So she negotiated with her office for them to actually take the light bulbs out above her cubicle, and that she put in a lamp because that was less stressful, so that everybody else with the light switch on could get the light that they needed, and that she got a different set of lights to help her be able to do her job better. So thinking about things, how can you negotiate and communicate your needs? So what's next? How do I become an advocate? How do I be intentional about advocating for myself? And so I always like to start with this slide. We at at Cancer Nation do our State of Survivorship survey. And we highlight and ask about the top financial, physical, and mental health concerns that survivors over the care continuum have. And so for us, we put that into 3 different buckets. And sometimes that's, because all these concerns and burdens can be really overwhelming. And so if you think about it in 3 different buckets, so what are my physical health concerns? Cancer costs us physically, emotionally, and financially. So are there ways that we can look at these and think, what do I want to tackle in this moment? Is it maintaining your health, getting an exercise, managing those awful side effects that you might have? Is it emotional? How is your mental health? Do you have the emotional support that you need? How are your relationships? Are you feeling isolated and alone? Are you uncertain about your future? And is that drowning you? Financial concerns, the costs of our prescriptions, our care. Is there financial support that we can seek out? How are we paying for our groceries? Are we have the time to understand our insurance and making the best decisions based on that? Getting and keeping our insurance, is our job something that we have to figure out how to keep it so that we can keep our health insurance? And the cost of caregiving for all of you caregivers, the invisible costs that aren't seen, and how do we take care of our caregivers? So becoming an advocate, we should all have resources. We should all have a standard set of good evidence-based information that is not overwhelming to be able to help us, direct us. At Cancer Nation, we have what we call our survivorship checklist. Points, not all the information, but kind of a starting point for you to ask the questions. How to communicate. Are there supportive services that would benefit me? Are there accommodations that can benefit me? Are there organizations that focus on these particular things? So that's our survivorship checklist, survivorshipchecklist.org. Another thing, as I am lucky to be here 11 years later, moving on to 12 years. And it has taken me 5 years into this post-treatment to really think about what it means to be healthy and getting in the right mental space to make decisions about my overall health. Because regardless, sometimes there's not a lot of decisions that we can make within the cancer care continuum. But there are decisions we can make about healthy living, how we want to take care of the body that we have been given, recognizing that we have our treatments essentially poison have been poured through them. And I want my rest of my years, however long they may be, to be the best quality of life. And so the NCCN guidelines, survivorship care for healthy living, are 60 plus pages of ways that I can improve my wellness overall to have a better quality of life. And if you haven't looked at that guide, I would recommend it. They also have one on late and long-term side effects that might be helpful to you, depending on where you are, but they're great patient-centered resources that essentially the checklist outlines and the guidelines give more in-depth information. But they're 2 great resources to get you started. And then the next thing that I would recommend, no matter where you are in the cancer care continuum, in your journey, and I actually would recommend that you continue to do this, is knowing yourself is so important. What your needs and what your wants are can change. We are not static. We change over time based on our lived experience. So, in a quiet space and a place where you can think deeply without interruption, what are your hopes in this moment? What do you hope for? What are the milestones and the goals that you have and would like to reach in your life? For me, over these 11 years, I have to be really intentional about wanting to feel joy. It eludes me in everyday maneuvering of life. And I have to be so intentional and think about, does this action, this thing that I'm agreeing to, bring me joy? And that's how I have to make some of my decisions. And over my it feels like a long 11 years, I have changed careers based on that goal. I have changed my focus and who I interact with based on that goal of finding joy. What is your current quality of life? And what do you hope your quality of life may be? What are you working towards in the arena of quality of life? 5 years ago, I could barely walk around the block. 5 years later, I am intentional about getting 30 to 60 minutes in moderate to vigorous walking exercise every day. But I didn't start that way. But I knew that would improve my quality of life. What are your concerns? What are you worried about? We all have worries. But if we're very intentional about writing them down and identifying them and them not being this cloud that just hovers over us, then we can be intentional about setting goals and being intentional about lessening those worries and those concerns so they don't impact our quality of life. And finally, what support do you have and what support do you need and desire? And what access in your community to support do you need? And identifying it and putting it down on paper makes it so much more concrete for you. And it doesn't, what you need and desire in one moment can be different in a different moment based on your concerns and current family dynamics or issues. So putting them down on paper and really focusing on knowing yourself is so important. And finally, I'm gonna put up some goals of healthy living. And I'm gonna first and foremost say, this is not meant to judge you. This is to give you options and control. That if you are not doing all of these things, that does not make you less than. These are just some options. Some of them are low-hanging fruit to be able to gain some semblance of self back and being healthy and working towards being healthy. And that's the most important piece. Is it walking to the mailbox, being in the sun for 15 minutes, but remembering to put on that big hat and sunscreen to protect our skin? Is it, how are you sleeping? Is there something you can do to improve your sleep? Most importantly, are you seeing a primary care provider? Are you working with them to be able to improve your overall quality of health and life? And that's so important because many of us don't have a lot of control on where we get our cancer care based on our diagnosis. We might need to see the specialist that knows our diagnosis in and out, but they might not be our person. And so we have an option to find our person in our primary care provider who can be our support person and to establish a relationship that will follow you through the end of your life, to be there for your overall quality and health. And that's super important. And you can essentially shop around for them. I'm on my fourth one in 6 years, because over time they didn't meet my needs or my concerns. And so that might be the control that you have in your cancer care that might empower you to be able to keep going with your cancer care, that you have a primary care provider who is able to be your support person in your overall health. And that's important too. Okay. Thank you very much.
Thank you, Dr. Panagiotou. There were so many great things in there that you talked about. Such great information. I really appreciate you sharing your personal stories as well. I feel like there's so much to learn from that. I did put some of the guides and other links that you mentioned in the chat. Thank you for bringing up the NCCN guidelines. I definitely also encourage people to go check those out.